The federal government is advocating need to strengthen the nation's health security architecture to enable it dictate and respond to the well-being of the citizenry. Minister of Health Dr. Osagie Ehinare said this while welcoming commissioners of health from across the country and other delegates to the National Council of Health meeting at the nation's capital, Abuja. The minister, who lamented the global challenge brought about by the outbreak of the COVID-19 pandemic, said the government is leaving no stone unturned in efforts to initiate strategies that will address emerging needs in a post-pandemic era. This, he added, informed the decision to establish an indigenous private pharmaceutical company that will make Nigeria a vaccine manufacturing hub for West Africa and beyond.
COVID-19 brought a rude awakening of how totally import-dependent we here in Nigeria are when it comes to pharmaceuticals, vaccines, and other critical commodities. The realization of the urgency of domestic manufacturing has never been so clear. Developing and supporting capacity to begin indigenous medical industry is a national security issue. To not only protect the citizens, but also mitigate capital flight derived from having to import virtually everything. We cannot afford that anymore. Federal government is working with an indigenous private pharma company to make Nigeria a vaccine manufacturing hub for West Africa and beyond.
Not taking chances on how primary health care centers can complement policies of government aimed at attaining universal health coverage, the minister charged the various state governments on need to prioritize the policy.
Side by side with this is a network of national primary systems to take care of the grassroots. New models of primary health care centers have been sent to all state governors, and they contain, in addition to the primary health care center itself, staff quarters, assured water supply, solar-powered aggregates, and a sound complement of human resource for health. These are the most important building blocks of our health system and should be prioritized by all states as the platform attains universal health coverage.
The relevance and implementation of the National Health Act 2014 was also played up at the meeting.
The National Health Act 2014 has provisions that can turn around our healthcare systems, but the challenge is implementation. Therefore, it is our collective responsibility to ensure that we maximize the provisions of this law through the full operationalization. I have no doubt that if this is done, we will achieve a resilient and responsive health system that will move us close to our collective dream.
The theme of the 2021 National Council of Health meeting is the journey to attaining sustainable development goals, applying lessons from the COVID-19 pandemic towards building a resilient national health system. Osagie Ehinare, CNN News.